So thank you everyone for joining us. And I do want to acknowledge today is International Women's Day. So I want to acknowledge all the women present here today, and all the women that make the this world a more wonderful and better place for us. So thank you all for your commitment and passion to do the work to help our communities. With that, just kind of a rundown on the agenda today. If you could share that on the screen, Argelia. We're going to have a presentation from Kern County Aging and Adult Services. This is something that folks here at this meeting have requested for us to bring information to you about services to the elderly. And so today we're going to have just kind of an overview of the services provided by Kern County Aging and Adult Services. We'll also have our kind of our usual updates. We do have Healthnet and Kern Family Healthcare providing updates for the health plans here, for the Medi-Cal managed care plans in Kern County. Any updates to that, they'll be providing that. Also Benefits Cal, we've kind of given the system a little bit of a, kicking the tires and checking under the hood to see what's there. We'll have Martha Esparza from Department of Human Services provide an overview on that and opportunity for you to ask questions as well. Also, we'll have our Medi-Cal and Covered California updates to see what's new with that. Covered California, hopefully we'll have some enrollment numbers for us to see how things kind of worked out with this open enrollment. So right now we're going to go ahead and get started with our Kern County Aging and Adult Services. We have Carolina Oler from the department to give us an overview, and after her presentation there will be an opportunity to provide feedback as far as what topics that you would like to have her come back and present in more detail, because like I said, this is going to be kind of an overview of all the services or the major services that they provide there at Kern County Aging and Adult. So without further ado, Carolina.
Yes, good morning. Thank you, Rodrigo, and thank you. Good morning, everyone. Thank you for having us here and presenting some of our services to you guys this morning. And definitely feel free to make some notes, and if you hear anything during the presentation that you would like us to expand on a later meeting, then feel free to send those recommendations. So again, thank you for having us. My name is Carolina Ayler, and I am the Information and Referral Specialist and Volunteer Coordinator for the HICAP program. There's a lot of material to cover in just 15 minutes, so I will try my best to leave some time for questions at the end of the presentation. Otherwise, feel free to email me directly and I'll answer those questions by email. So I want to start by, let me just share my screen here. And here we go. Okay. All right, and I want to start by reading to you our mission statement here at Aging and Adult Services. And I'm trying to go to my next slide. There we are. Our mission is to provide services that protect, preserve the dignity, and support the independence and safety of all older adults and disabled individuals in our community. Our offices here are in Truxton Avenue. We're open to the public by appointment only. Most of the referrals and services we provide can be initiated without the client coming into the office. If the client wants to make an appointment, we will determine the need for the appointment and either schedule them to come in or take care of them over the phone. The next slides will go over some of our most popular programs, and we'll start with the Adult Protective Services. The Adult Protective Services program investigate instances of abuse, neglect. For those that are obviously willing to accept the services, APS will provide that linkage to the appropriate resources and cross-report crimes to law enforcement. Sometimes people don't really know how to look for abuse or what are those red flags to look for. But some of the most common type of abuse that we see is physical, neglect, financial, mental suffering, isolation and abandonment, and one of the most popular, self-neglect. So some of the red flags to watch for when we're looking for abuse is starting from the most obvious, unexplained bruises, dehydration and malnourishment, over medication, lack of cleanliness or grooming, fear of the caregiver, or maybe some sudden change in their mental status. As mandated reporters, some of you are, or most of you are mandated reporters, you do have an option to call in a verbal report or submit a report through our website, and that will eliminate your verbal report. To report abuse, there is the phone number in the bottom, or again, you can visit our website. The eligibility criteria for the services are individuals age 60 or older, or dependent adults. Those are individuals between the ages of 18 and 59 with a physical or mental disability. So once you report the suspected abuse, there is the possibility that the individual will refuse services. Most times the social worker makes contact with the client or the victim, and they might say, I'm fine, everything is fine. And sometimes the reasons are because they're afraid of public exposure. Sometimes they're trying to protect the abuser, or they are, in most occasions, they have fear of retaliation. So what you can do to help is definitely report it. Even if you're not 100% sure, a report will initiate a social worker to make contact with the victim to provide resources and options. This is a voluntary program, again, so if the victim refuses services, we can't force those services on them. Mandated reporters, again, do have the option to call or visit our website. The next program I'm going to go over is the InHome Supportive Services, one of our most popular programs here at the agency. This is a program that provides personal and household services to age blind and disabled individuals. So the eligibility criteria, as we can see here on the bottom, 65 years of age or older, or adults that are legally blind or disabled. This is a Medi-Cal funded program. So if the person applying does not have Medi-Cal at the time the referral is initiated, the IHSS program, as part of their intake process, will assist the client with initiating a Medi-Cal application. So we get them started with that process. The referral is assigned to a social worker who will do an assessment to determine the client's needs and how many hours the client will be allocated for their care. There's also a medical form that they need to submit to their social worker as part of their eligibility process. And then once the client is approved, they will get a list of care providers who are registered through our agency. But also what we see is that the client already has a caregiver, and that could be their immediate family member, son, daughter, or spouse, or even a neighbor or a friend. That person sometimes has to take time off work to take care of their loved one. So we can pay them for their for the care that they're providing. So basically, if they registered to be a care provider with us, then they can get compensated. So this program will also help supplement some of that income that the provider is no longer receiving because they have to take care of their loved one. So again, this is, like I said, it's a Medi-Cal funded program. This is a benefit that Medi-Cal recipients get. Obviously, they have to meet the criteria, and this is not something that is covered by any other insurance or Medicare because it's not medical services, it's strictly custodial. So personal care services like bathing, grooming, dressing, eating, moving, transferring, that kind of stuff. So if you need to submit a referral or you know someone that needs care in the home and they want to apply for this program, there is the referral line listed right here. And all you have to do is call the referral and we'll get them started. The next program that I want to go over, you might have heard of it in the children system, is the Healthy Living Program. We have it here at Aging and Adult Services. This is a program that where we partner with the USDA, the California Department of Aging, the University of California Cooperative Extension of Kern County, and the Community Action Partnership of Kern County. So this program is designed to provide nutrition and physical activity to low-income seniors. The classes are online via Zoom, and the individuals must be 60 years of age or older. This program helps them establish healthier eating habits and more physically active lifestyle. There's a lot of classes to choose from. The classes will demonstrate healthier eating habits, things they can do to change their diet to make their meals healthier, how to measure their food, how to read labels at the market. They also have great exercise classes that are low impact with less risk of getting hurt. If you need to refer someone to this program, again, here is our main number. And all you have to do, or they have to do, is request to speak to a health educator. And our next program that I want to talk about is also one of our big programs here in the agency, and that is the Health Insurance Counseling and Advocacy Program. We are part of a bigger umbrella called the SHIP Network, is the State Health Insurance Assistance Program. That program exists everywhere in the United States. In California, we know the program as HICAP. The Health Insurance Counseling and Advocacy Program provides free assistance with Medicare problems and other health insurance issues for seniors and disabled adults. The services are provided by trained counselors, just like many of you, except they are trained in Medicare, registered through California Department of Aging, to provide unbiased Medicare insurance counseling. So again, we are specifically trained, and I said we are because myself, I am a HICAP counselor, have been for 4 years. We're specifically trained in Medicare insurance options, and we are the experts when it comes to Medicare. We review all options with clients in order for them to make an informed decision when choosing a plan. We help them understand the ins and outs of Medicare and screen all of our clients for programs that can help them save money, because some of you might know or might not know, Medicare isn't free. Medicare costs money. So there are programs that can help our beneficiaries save a lot of money. So we definitely screen them all. We want them to apply to these programs. We want them to take it if they qualify. We also work closely with Department of Human Services, and we have been assigned a liaison that helps us with Medi-Cal case issues, such as helping removing share of costs, making case corrections, understanding notices of action. So our Medi-Cal liaison is very busy with us because we do have a lot of clients, and a lot of our clients do have Medi-Cal. And a lot of times they are confused about the notices they're receiving. We pretty much learn them all, but from time to time there are cases that we don't understand. So it's good to have that partnership. Basically we work on this all year round, not only open enrollment. We are constantly helping beneficiaries that are retiring, They're entering Medicare. They don't know what to do. They don't know if they should enroll in this or that. What is important is that when they come to us, we're unbiased. We give them our unbiased counseling. We don't endorse one plan or another. We don't go into insurance per se as far as the details of this plan or that other, but we do give them at the orientation. We teach them their rights. We tell them, yes, you can enroll with no penalty. We study their case. We help them when they have billing problems. We help them do appeals. And we also are part of the SMP, the Senior Medicare Patrol, which is a program that helps us help the senior detect, prevent, and report Medicare and healthcare fraud. That's a big program. There's a lot of scams going on Medicare, and there's a bunch of trends going on. So that could be a topic we can explore in the future. So that can help your beneficiaries as well. And like I mentioned before, our HICAP program runs with volunteer counselors. We are currently seeking volunteers. We're having a volunteer training coming up in April. Again, our volunteers are highly trained by CMS, the Centers for Medicare and Medicaid Services, California Department of Aging, and California Health Advocates. We do a lot, but it is a very rewarding experience. So if you know anyone that's looking for a meaningful volunteer experience, you can send them my way. The next program I'm going to talk about is the Information and Referral Program. So the Information and Referral Program, it works at a call center, and we help seniors and individuals with disabilities and their families identify and access programs and services to meet their specific needs. So people can call us and they can ask any question. How can I get transportation? I need a housing list. I need a homemaker agency list or a placement agency list. How do I apply for home repair grants? Or I need to install a handlebar or a ramp outside of my house to get in and out. All those questions, if we don't have an answer for it, we'll look for the resource and we connect them. We also provide assistance with reading and filing out forms when clients are unable to read, write, or have a disability, to prevent them from filling out the forms themselves. They can make an appointment, come in, bring their form, and we help them fill it out. We don't help them answer it, but we help them write it for them if they are unable to. So basically the INR program is like a one-stop shop. We get most of the incoming calls. And again, like I said before, the goal is to connect them to the right resource. And finally, and I believe I'm running a little bit over time, is our Meals on Wheels program. This is also part of a bigger program that exists all through the United States. These are home delivered meals that are available to people over 60 years of age, and they have to be homebound, basically by reasons of illness, incapacitation, disability, or isolation. They have to be unable to leave their homes. Also important to note that if they do have a caregiver or an adult child that can cook for them, they will not receive the services because then they have someone that can prepare a meal for them. The program receives donations. However, they don't deny services if the individual is unable to donate. I think there's a $3 that is requested, but not required. And again, the referrals can be made by phone or online, filling out our intake form. Again, these meals are distributed from many nutrition sites in the community. And the application process also includes a needs assessment and a physician's referral. So that is the short version of my presentation. And I don't know if we do have any room for questions.
There we go. Let's see. The other question I see on here is, do you have any bilingual staff?
Yes, most of our staff is bilingual, and we always have someone on shift.
Any other questions for Carolina? So on the Meals on Wheels, if there is a person living with a senior that is able to provide a home cooked meal or provide meal preparation or get them food, they're not eligible for
No.
service?
It's basically for, and well, and if there is a couple living together, but the let's say that they're requesting the services for the husband, and the wife can cook. Sometimes it happens too. Husband and wife can't do it, even if they're living together. None of them can cook for themselves, and they don't have a caregiver or a person that can come and cook for them. Then they will qualify. But if they do during the assessment, they determine that they do have someone that can cook the meals for them, then unfortunately they will not be receiving the service.
Now, do you have do you work with other programs like in conjunction with this? Like, for example, if they are not, if they don't qualify or not eligible for the Meals on Wheels programs,
Absolutely,
do you refer them to like the food bank, or do you provide food, unprepared food yourselves?
Okay, so all of the above, because we have many other resources that we can offer them if they do not qualify. So they're the food banks, that's one. We also have snack boxes available for seniors that don't have any food, but it's a snack box, so like packaged tuna and crackers, and it's just like a amenity box. But we also work with the gleaners, and we do have the senior SAC program. In the senior SAC program, individuals can go to a nutrition site that is participant of the program and pick up groceries. Basically, they call it a food box, but it is 2 big bags of stocked with good groceries twice a month. So all they have to do is meet the income criteria and be over the age of 60 and just sign up, and then they can go and pick up food. There's also emergency food baskets. So when someone has a hardship, they had high medical bills this month, or electricity went up and they cannot afford to go and buy groceries or food, we can give them a one time every 6 months, a referral to the gleaners to pick up food. So there are many options.
Okay, great. Well, we're gonna, I don't see any other questions in the chat. So we are gonna provide an opportunity for our CCs to, provide some input as far as what topics they would like more in-depth information on. So if you can go ahead and select from our poll the topics that you would like to see presented at an upcoming meeting, please feel free to provide that input. And I'm sure Carolina would be happy to come back and do the presentation on all the topics, but I don't know if I don't know if the interest is there, but we'll see if how we can gauge that. All right, did everybody have a chance to fill it out?
We have 16 out of 25 people that have voted.
Rodrigo. All right. Well, thank you, everyone, and thank you, Carolina, for coming and present to us. I know that you'll be back, hopefully, at our next quarterly meeting, and we'll see what the highest voted topic was, and have you present on that. So thank you, Carolina. And thank you, everyone, for participating in that. We're going to move on. We have our health plans, our managed care plans for Medi-Cal, Healthnet, and Kern Family Healthcare, providing us an update on their services. So we're going to go ahead and get started with Monica Nagel from Healthnet, and she's the Director of Enrollment and Retention for the Medi-Cal program. Monica, good morning.
Thank you for that very nice introduction. My name is Monica Nagel. As stated, I am the Director of Enrollment and Retention for Healthnet. I manage, I have oversight of an enrollment and retention team that I hope can be really helpful for some of your population and clients. I'm going to go ahead and do a pretty high level overview on some of the services that Healthnet offers. And then, if there are any questions, I'd be glad to take them. I'll also be offering ways that you can get in touch with us via email, ways you can have your clients get in touch with our enrollment team if they don't want to call, if they want us to reach out to them. So kind of give you a full picture here. And I have Angela running the slides today. So Angela, thank you very much. If you can move to the next slide. Thank you. So at a quick glance, Healthnet has a very, very large membership in California. We're at over 2.1 million members across the state, 82,000 specifically in Kern County. So we're very proud to serve all of this membership and to be able to assist them in any way we can. And that's what my enrollment and retention team does. We do focus on, of course, enrollments, and then we assist our Medi-Cal members with their annual redetermination. So I have a very, very busy team. Next slide, please. Thank you. So just, a little brief overview. This isn't all of our service areas, but we tried to just kind of focus on your area. So you can see here, we do offer Medi-Cal through Healthnet in Kern, San Joaquin, Stanislaus, and Tulare. We do contract with Calviva Health to arrange for their network services out of Fresno, Kings, and Madera County. In addition, in Kern County, we do offer our IFP plan through Ambetter by Healthnet. Next slide. This is again just focusing on the counties I think nearest you. We do currently have, and we just pulled this information up, so it says current as of Friday, but things do change often. But as of Friday, we have 876 contracted doctors in Kern County, 10 hospitals, and 68 medical groups. You can see across this slide, we have a very large number of contracted physicians and providers. We are also at the end of this deck, and I believe Angela sent it out, and you may get a hard copy of it. But at the end of the deck, we do have some resources available that can show you directly a web link to get into the provider network site off of healthnet.com if you wanted to look for specific physicians. Next slide, please. All right, so let's get into some of our benefits. So, if you go around the wheel, you're going to see kind of, I will say, the benefits that all health plans are going to be offering. So outpatient, hospitalization, maternity, newborn care, all kinds of, different information here. So, oops, just clicking on that. So one thing I do want to focus on is some additional benefits that Healthnet does offer to our membership. We do work with, transportation as a benefit. We work with transportation care coordination. We do offer, of course, a personal doctor who will oversee all the members' healthcare and referrals. We have, access to providers, pharmacies, and hospitals as close to the member's neighborhood as possible, as is shown by the previous slide with our large number of contracted physicians and other providers. We offer a multitude of health education programs, which I'm going to be speaking about on one of the next slides. We have multilingual representatives to assist our members. We offer eye exams and eyeglasses for both adults and children, and that's every 24 months they're eligible for that. One thing I really, really love to point out, and I'm proud to say, is that we do have a 24-hour nurse advice line for our Medi-Cal membership. It's available, anytime they need it. There's a direct line, or if they call through the member services line, there's an option off the IVR that they can select to get connected with the nurse advice line. And in addition to that, our member services line is also available 24 hours a day, 7 days a week, never ever closes. So our members have the ability to reach out and talk to either a member services person for assistance, or maybe if they need more clinical information, or they're just maybe they're not feeling well and they just want a little more guidance, but they're not ready to go to the doctor. They can also get in touch with our 24-hour nurse advice line. So I'm really proud to say that we are available to our members 24 hours a day, 7 days a week. Next slide, please. Right. And here are some programs that I really like to point out and you know, discuss. I'm gonna move something over here so I can see a little better. These programs are available to our members at no cost to them. They're just some additional programs that we make available. So we do offer telehealth services through Babylon. That includes, you know, live chat, virtual visits. And as everybody knows, telehealth, you know, over the last 2 years has become really huge, and a lot of our members are using it. So we're glad to have that available for our members. We do offer behavioral health services through MHN. That's going to include mental health services and substance use disorder treatment. So we do have that available. Health education materials and classes are available for a multitude of items. We do have a disease management program. It's called Be in Charge, and that does specifically focus on diabetes, asthma, and heart failure disease management. In addition, we offer a weight control through Fit Families for Life. We have a smoking cessation helpline through Kick It California that people can get assistance there. We have a pregnancy education line assistance through Pregnancy Matters, which offers education and support. And really the primary focus of that is to assist members in learning how to have a healthy pregnancy. Healthy pregnancy should hopefully lead to healthy babies, so we want to get that started right up front. We do have another mental health program. It's an online tool through My Strength, and My Strength offers a lot of assistance on how to reduce stress, depression, and worry in order to be more mentally stable, mentally healthy. And this last one, I'm very proud to say, is a newer program. It's been in place for just a couple of months. We do have a diabetes prevention program through Yes Health. It is an all-mobile program, and members can apply if they qualify for the program. They're sent a welcome kit and a digital scale to keep track of their weight. And then they're also going to get personal coaching as often as they need it, or as often as they request it. And that has been a really valuable program to our membership. This next slide, excuse me, talks about some of the resources that we're just trying to make available and easy for you to get to. We have a link here to our member handbook. The middle link is directories by county, but specifically to Kern County, we also have that in that third website link that you can go directly to providers in your county. What I really want to point out on this slide is at the bottom here, there is an email box. If you're working with somebody in your community who is currently a Healthnet member, or if there is possibly a general benefits question, we really encourage you to use this email box. We have it staffed at all times. You will get an answer within 48 hours, and it's Medi-Cal_inquiries@healthnet.com. And again, as I said, we focus on if you have a member who is currently with Healthnet, because then we can communicate with them if necessary, or if it's just a general benefits question. Maybe you have somebody ask, I'll go back on the vision thing. If you have somebody say, hey, what kind of vision coverage, how often can I get glasses? Or we have somebody who's inquiring about that if they become a Healthnet member. Something general like that can go to this box. And the next slide. One more. Okay. And this is very quick. I'm going to show you. You can go ahead and go to the next slide, Angela. That's okay. There we go. So if you have somebody who is interested in talking to us about enrolling with Healthnet Medi-Cal, they can call our enrollment line directly, which is 1-800-327-0502. And my enrollment and retention line is open and available to assist Monday through Friday, 7:30 a.m. to 6 p.m. But maybe they want us to contact them. this is the easiest way to go ahead and do it. Can you run the short little video there, Angela? There we go. This is very quick. If you go to healthnet.com and click on members, and then on the left, click on enroll now, it's going to take you to the page where you can pick which line of business. And if you click on Medi-Cal, it's going to take you to a really great Medi-Cal page. It has a lot of information about Medi-Cal and Healthnet here. And then a little more than halfway down the page, there's a form they can fill out. First name, last name, phone number, zip, email address. If they go ahead and submit that they're agreeing to allow my enrollment and retention team to outreach to them. And we get those within 24 hours, and we will turn around and reach out to the member and assist them, answer their questions. You know, if maybe they have a question that really doesn't pertain to our department, we will definitely get them to the right place. But this is really specifically for enrollment. And the next slide. I think that's it. So I'd be happy to take any questions. I do want to, make sure that you have that email address if you have any specific question for a member. Also, I can make my contact information available. Or even if you reach out to Angela, my partner here, we would be glad to assist or answer any questions as they come up, even if there aren't any today. And I really want to thank you for the time and allowing me to take some time to present to you. This has been great, and I hope that it's helpful.
There we go. Let me unmute myself here. Thank you, Monica. I don't see any questions in the chat, so we're going to continue. Yes.
I'm sorry. Hi, good morning. This is Nancy. Hello.
Hi.
Thank you for the presentation. Very valuable information. My question I have for you is, what are the methods of transportation that's offered to our clients here in Kern County? For example, are you using Uber, Lyft? Which are the methods? And also pertaining to, do you do mileage reimbursement? And if so, has that form changed or been updated?
You know what? I'm going to have to take away on that, but I will jot the note down. I was actually just talking to one of my partners at the member services. I used to actually be a manager at member services, so I still have a lot of really good partners there who love to share their information with me. I'm very fortunate. So we were just talking about transportation yesterday. So I would love to take that away, Nancy, and then I can send you some specific information. So it's the mode of transportation in your county, and then the reimbursement, right?
Yes, and if that form has been updated or if it has changed. Okay. Yeah, and, if you send that over to Argelia, and then she would go ahead and make sure everyone that's on the team right now or in the Zoom meeting will get it.
All right. I will take that away and I will get back to you. Hopefully I can get that even out for you by today, okay?
Greatly appreciated. Thank you.
You are very welcome.
All right. Well, thank you, Nancy. Thank you for that question, and Monica for responding. And we look forward to getting that information here for our clients that have Healthnet. So thank you very much. All right. Well, we're going to continue. We have Maritza Jimenez from Kern Family Healthcare to talk about a little bit about the managed care plan, Kern Family Healthcare, that any updates that she might have for us. So Maritza?
Yes, hello everyone. It's Maritza with Kern Family Healthcare. Happy to see you all. Rodrigo got a little tongue tied. Maritza's making him nervous. It's all good. It's all good. Yeah. Well, I'm happy to see you all today. Happy International Women's Day to all our women, making a difference and keeping our community healthy. Definitely, it's something that women are very passionate about. Rodrigo, you have a little piece in there, but our women's all about it today. So congratulations to all our women. So today I really just wanted to start. I usually keep you guys updated at what we're doing, we're not doing. So I just wanted to highlight 2 different programs that we kicked off this year, and just wanted to tell you a little bit about it. I'll try to answer as many questions as I can at the end. It's just very basic information that I have for you guys today, and then highlight a few things at the end. So first of all, it's just a reminder to our CECs that Kern Family Healthcare, well, the Medi-Cal managed care health plans no longer cover the Medi-Cal, the prescription part of the coverage. So just a reminder, effective this January 1st, Kern Family only covers anything that has to do with health and VSP, which is anything to do with vision. All your pharmacy benefits come out of Medi-Cal RX. I know that's something that I just had another group that it was members and they're still, you know, confused. How come Kern Family is not paying my prescriptions? So, and I know it's something new and, you know, we're gonna learn as we are getting the services. So just a reminder to our CECs to let them know, or if you have social media, let them know that this is something that changed. I wanted to highlight, first program I want to highlight, it's called Enhanced Care Management Program. So it's called an ECM program. This program provides care, coordinate care, and a care team to work with members and their healthcare provider. So I'm going to give you the list. It assists members in finding a doctor. It assists in scheduling an appointment, and assists with finding housing, with getting transportation to doctor's appointment, and assists with follow-up care when the member leaves the hospital. Who's eligible for this program? This is for adult eligible, so they have to be currently homeless or might become homeless. So this new ECM program is for those individuals that are not, you know, you're coming, I'm going to schedule my appointment because they're homeless, they don't have a home, they don't have a phone they can have easy access to. So it's targeting those individuals to keep them on track with their health. If a member has difficult health issues, going to the hospital or emergency departments in the last 6 months. So we're targeting people that we see are currently going to the hospital. Let's say high blood pressure. They keep on going to the hospital because their high blood pressure is elevated. Well, what's causing that? You know, so that's the reason we have a care team that's going to find out is it, are you not taking your medication? Are you not picking it up? Is it your diet? So based on that, we're able to help coordinate their care to get them to a healthy way of getting services, let's say, and maintaining their health. If they have a serious mental health illness or struggling with drug or alcohol abuse, those can also be enrolled in this program. Or if they recently were released from jail or prison and need help returning to living in the community. So those people getting released from jail that they don't know how to, you know, access the care, they don't know who to call, you know, where to go. So those are the eligibility for this program. Members who do not, and then people that, so these people here, you refer them to us, or they can self-refer themselves on their own. So if they're confirming healthcare members, they can just say, hey, you know, I feel like I meet this criteria, I'm homeless, I was told by one of the CECs that I might be eligible. And then we enroll them. As soon as we enroll them in this program, we help them get them to, you know, some good health status. And then on top of that, we are rewarding them with gift cards for just going to the doctor, which I'll talk about it at the end. The members that do not qualify for this program is if they're in hospice services. Just a note on that. The next program that we are launched this year is called Community Support Services. This program is to create social, physical, and economic environment to promote full potential of health and well-being for all our members. So what it does, it helps our members with our members to obtain housing. So housing transition and navigating them through the services. Housing tenancy and sustained services. This service provides tenancy and sustained services with the goal of maintaining safe and stable housing and secured housing. Short-term post-hospitalization housing. What does this mean? To provide beneficiaries who do not have a residence or have high medical behavioral health needs with the opportunity to continue their medical, psychiatric, substance abuse in an existing institutional setting. So what we're doing is contracting with facilities that can take them as soon as they get out of the hospital. For example, you have a homeless person that just got out of the hospital and they need to go recuperate. Where do they go? So we are going to help them navigate to find them a location where they can recuperate to get better so they can get on their own or wherever they need to go. Recuperative care as well, short-term residential care for beneficiaries who no longer require hospitalization, which is what I was talking about earlier. Asthma as remediation. This is, for example, there's a home that they live in that is causing their asthma to flare. So we need to look at the household and say, well, what's causing it? So if needed, we can provide items to help them. For example, we can help them find out if there's mold. Okay, what do we do to alleviate that? Do we need to improve their ventilation? Do we need to get them some humidifiers or air filters? Or like what's causing the asthma to happen? So Current Family Healthcare, it's a program that will help them get these items to get their house taken care of so they can be, so their asthma doesn't flare up, for example. So those are some of the benefits that this new benefit community support services covers. Who's eligible for this program? They have to be experiencing homeless or other complex health, disability, or behavioral health conditions. So it can be just me, you know, like a normal healthy person being like, oh, I want you to come to my house and check out my house because I have asthma. It has to be someone that meets the requirements of that I just mentioned. So they can call us and self-refer themselves, or they can be referred by a CEC and say, you know, we feel this member meets your requirements for this program. So there is no age requirement. So if there's a teen that's homeless, as long as they're considered homeless, they're eligible for this program. Or if they have a complex health issue, like I said, like if they have like high, like asthma triggers, you know, and stuff like that. So with that said, those are the two programs that we launched this year. They are brand new. I'm learning as I go as well. I can have a representative that targets that program if you guys want it. Come and talk to you guys if you want to know specifically on one, because they can go more into details. I just been very general. So let me know on those two programs if you wish to bring someone that you have more questions for that I can answer. The other thing I wanted to talk about was our rewards program. So our list has grown a lot. So I thought it would be easy for me to pull it out on our website. So in this, all the CECs have access to this. All you gotta go is Current Family Healthcare website and access. So I'm gonna see if I can pull it up. Let me know if you do not see it on your end. Rodrigo, can you see it?
No, I see your
Our website,
presentation.
okay.
I see your
Let me go back
presentation.
into your PowerPoint and share it. 1 second. One second, I'm trying to. It's not giving me access to share.
Just a
Sorry about
reminder
this.
for folks to type in your questions. If we don't get to your questions today, we'll definitely reach out to the presenters with your questions and have them provide more information about that. So don't think that just because we don't get to your questions today, or you type in your question at the end of the meeting, we can also get that over to the presenters. All right.
Are you able to view this one?
Yes.
Okay. So what I did is I just went directly and gave you a link to the members rewards program. So we have a rewards program for our new members, for our pregnant members, and our care and wellness visits. This is for, you know, when they go for the regular care. So I'm gonna pull up the rewards program postcard, which you all have access to, and just show you. Are you able to view that? Just making sure.
Yes.
Okay, great. So I'm just going to highlight a couple of them. So for example, this is a list of all the rewards programs that we have. If they're a new member, which I've discussed this with you guys before, and they complete a health initial, like if they go to the doctor in the first 120 days, they get a $10 gift card just for going to the doctor. If they go for their annual care visits for their kids from ages, pretty much from they're born up to the age of 21, they get gift cards. So if it's annual well care from 3 to 21 years of age, you get $15 gift cards. If it's baby well care, they get $10 gift cards. And for example, if they're pregnant and they go see their doctor within the first trimester, the first 3 months of being pregnant, we send them a $30 gift card. Once they have their baby and they go for their postpartum care, we send them another $30 gift cards. For our women that are getting their breast screenings, cervical cancer screenings done, when it's their annual, we send them $15 gift cards. So what we're trying to do is we're trying to reward our members to when they go to the doctor. We want them to know, like, we appreciate them going to the doctor, so here's a gift card, right? So it's just like an encouragement in addition to what does the member have to do on their end to receive this gift card? They don't have to do anything. So all they got to do is go to the doctor when the doctor bills Kern Family Healthcare for their annual visit or for their breast cancer screening. We're going to know they went in for that screening. Therefore, we have to send them a gift card to their household. So they automatically get the gift card as long as they're going to the doctor for those different ones that I mentioned. And there's a list for you guys. You guys can read more about it on your own time. But those are just some of the incentives Kern Family Healthcare is doing just to get them into the doctor, because I know sometimes it takes a little bit of time.
Great.
So I'm gonna go one more slide. I'm almost done. Sorry. And the last slide I wanted to talk about, and can you see the oh, I got two more, Rodrigo. So can you see my slide where it's talking about mobile app?
Yes.
Okay, perfect. So the mobile app, just a reminder, don't forget that we have a mobile app. So everybody's always on their phone. I'm always on my phone. So remind them they can download the Link app, which will give them access to switching their own doctor whenever they want, seeing who their doctor is, updating their address from if they lose their card and they want to pull it up on their phone, they can pull it up on their phone. So we're still paying $10 gift card if they get their mobile app downloaded into their phone, just a reminder. And lastly, I know there are CECs that always wanting to know, like, who's your providers and give us the most, updated information. We print our provider directories, as soon as they're printed, we're having to update them again because there's always new doctors coming in or doctors coming out. So the easiest way to be in control of knowing what Kern Family Healthcare is up to is going to our website. So I put our website there, KernFamilyHealthcare.com, and there you can do a search for our doctors. You can check out our newsletters, and then you can look at our member portal. Just go under the member section or provider section, and it will give you all the information on Kern Family Healthcare. Those are the only, that's all I have for you guys today. Just a question that Nancy highlighted to Healthnet, just to a reminder for our group, is that we're still offer Uber transportation to and from the appointment to the doctor. We still have mileage reimbursement for our people that do not have transportation, and we have bus passes as well. So remember, the key to this services is they need to not have transportation. So when they call us, they have to let us know we do not have transportation to go to the doctor. So right now, gas prices are going to go up, and some of our members, live paycheck to paycheck. They might not have money to pay for gas to fill up their car. That's considered a barrier, right? So they can access that. If they say, you know what, I don't have gas in my car to go to the doctor, we can provide mileage for transportation to the person that's going to take them to the doctor, and we'll pay them for taking our member. Just a reminder.
Great.
I'm going to stop sharing, and if there's time for questions.
I don't see any questions in the chat.
Maritza, I'm sorry, the same question. Has that mileage reimbursement page been updated, or is it still the same one?
It's the same. If you go to KernFamilyHealthcare.com, under members, you'll be able to view our transportation. There's a link and it tells you all about our transportation, how much, what we pay, the forms, and pretty much what I just told you right now, what we cover.
Thank you.
Mm-hmm.
And Maritza, just a follow-up question, says, where would current family healthcare members call to enroll in the ECM or CSS programs?
So they're gonna call our regular number 1-800-391-2000, and they can call there and then just let them know that they're interested in either program. Like I said, both programs are really good because what we're trying to do is help them navigate the system because they're not familiar. As you can see, based on the eligibility of the program, it's really for those people that are vulnerable. So that they don't normally know how to access the system, and that's what we're trying to do. We're trying to teach them. So we tell them who to call, when to call, what doctors to call, what programs we have, the rewards program, and then we just teach them to utilize the services so they can get on their feet on their own.
Great. Thank you, Maritza. I believe that's all the questions. Argelia put the phone number in the chat, so members can call that number and request more information and registration into those programs. So,
perfect.
thank you,
And you know what, Rodrigo, really quick, I forgot to mention just an update for our CECs. If anybody's in the Ridgecrest area, effective this year, January 1st, Kern Family Healthcare became one of the health plans for Ridgecrest. In the past, the state only had one health plan, which was Healthnet. They can only choose that plan or be on straight Medi-Cal. Now, effective this year, Kern Family Healthcare became one of the health plans they can select. So it became a 2-plan model, same as the rest of Kern County. So if you have any CEC enrollers in the Ridgecrest area that would like to talk to me or want to find out more information, please call me 664-5536, and I can explain a little bit more about that.
Great. It's good news. All right, so we're gonna continue on. Let me double check the chat. So we'll continue on with the agenda, and then we have Martha Esparza here ready to do her presentation on Benefits Cal. And I just want to, we have a poll to see if you've had the opportunity to use Benefits Cal to complete a Medi-Cal application. Anybody has been on there? Well, we'll see right now what Argelia tells us about a question in the poll. See if folks are familiar with Benefits Cal.
Yeah, Rodrigo, out of the 26 people that are currently present, 13 have voted and 11 of them said they have not.
Great. Oh, they have not.
They have not, no.
Okay. It's a new system. I myself have not filled out an application, although I am a registered user on that system. I know Nancy in our office has filled out a couple, I believe, of applications, but we're going to let Martha Esparza provide us a little bit more information about what kinds of things to expect on Benefits Cal. So Martha, thank you for waiting and being able to present today.
Yes, hi, good morning, everyone. So yes, my name is Martha Esparza. I am with the Kern County Department of Human Services. I am the regional representative on Benefits Cal. So I'm really excited to be able to provide some information to the CECs and everybody on this meeting. So I do have a little video that I wanted to share that has a lot of the details specifically for the CBOs and how they can utilize Benefits Cal. And so just really quick, Benefits Cal did replace See For Yourself in Kern County on September the 28th of 2021. Benefits Cal was designed and developed to make it an easier experience for both CBOs and enrollers and our customers to be able to submit applications to our departments easily, quickly, and of course, with confidentiality. Sorry, can't get that out of there. The system was developed with a lot of input from the customers and from the advocates. So again, a lot of enhancements from, if you've used See for Yourself before, Benefits Cal is 100 times more easier to use than See for Yourself. So I do, again, have a little video that I want to go ahead and share. And it's going to provide a lot of the details of how it's used specifically for CBOs. And hopefully the 11 that haven't experienced or gone in to utilize Benefits Cal will definitely change their mind to use it. Excuse me. So here I go. I'm going to try to share this. I'm going to cross my fingers because I've never done sharing on Zoom before. So here we go.
We don't see it yet.
Okay, so like I said, this is the first time I'm doing this, so give me 1 second. I do apologize.
No problem. There we go.
I'm going to start it over again. Sorry, guys.
This video will show community-based organizations the various features for CBO accounts. In this demo, we will cover many topics for CBOs using Benefits Cal. This includes how to request access, how to log in, the CBO dashboard, how to submit applications.
Could you guys hear that?
It's a little low.
A little low. Okay, I have it all the way up. Let me see if I can continue to turn this up more. Let me see.
How to view reports, how to create and manage staff accounts.
Was that better?
It's a little better, but well, it's still low. We can hear it.
Can you hear it? Okay. Again, I apologize. This is the first time on Zoom. Let me see. Is there something I'm doing up here that's okay? I'm gonna let it go and apologize if it's not the best.
And where to view the help center. So, what is Benefits Cal? Benefits Cal is a new, simple way to apply for assistance and manage benefits, such as food, medical, and cash assistance, all on one website that is accessible from any computer, tablet, or mobile device, all available in 21 different languages. Community-based organizations or assisters can do several things on behalf of clients within Benefits Cal. They can submit applications, upload documents, check application statuses, view reports of their activity, and create and manage staff accounts. There are two types of CBO accounts available on Benefits Cal: a CBO manager account and a CBO staff account. Both managers and staff can use Benefits Cal to apply for benefits, upload documents, and view reports of their applications. CBO managers can also view reports that include the activity of the staff in their organization. Managers can resume applications on behalf of another staff member, and managers can add or remove staff accounts within their organization. Let's review how to request access to Benefits Cal. Let's get started. Navigate to benefitscal.com. From the homepage, click Login at the top right corner of the screen to get started. On the login screen, click Register your CBO account under Community-Based Organizations, or CBOs. To request access, complete all the required fields. For the county, select the county where you assist the most clients. It's possible that you work in more than one county, and that's okay. Just select one for the form. Check the box to accept the terms and conditions. Then, click Register to submit your access request. The access request is on its way to the county. The county will review the request for access, and it may take a few days. Once approved, the county will create your account and send an email with instructions to get started. Here's an example of the email you will receive. The email includes instructions to complete the account registration process, as well as the user ID and a link to complete the account registration. Click the link to continue. Enter a password for your BenefitsCal account. The password must be at least 8 characters long, have at least 1 letter, 1 number, and 1 special character. Re-enter the password. It must match. Then click Save. After creating a password, log into BenefitsCal using your user ID and the password that was just created. Then click Login. Enter 3 security challenge questions to help you recover your password in the future. Select a security question from the drop-down menu, then type the answer in the boxes provided. Then click Save. Finally, click to accept the BenefitsCal terms of use. Next, you'll see the CBO dashboard. Here's the BenefitsCal dashboard for CBOs and assisters. At the top of the screen are menus for various topics. BenefitsCal is also available in many different languages, accessible from the drop-down menu. This is the dashboard for CBO managers. On the left is information about applications. Click to view staff applications and the status of applications you submitted by their status. Click the New Application button to start a new application. On the right is access to reports, staff accounts, and help resources. Now, let's look at how to view applications submitted by staff at your organization. Click View Staff Applications on the dashboard. Here, CBO managers can view the applications submitted by their staff. Click the View button to see a list of applications by status. Let's explore in-progress applications. The application screen displays the applications by status. Click the Continue button to resume the application and to submit the application. After clicking Continue, the application summary screen will display the steps to complete an application. A CBO can continue the application by clicking Start next to each section. Click the BenefitsCal logo to go back to the dashboard. Click View on the dashboard next to Application Submitted. This screen displays more information about the application. Click View Details on the Application Submitted screen to view more information about the application and to upload documents. The Application Details screen displays summary information about the application and allows CBOs to upload documents. Here you can see the application status. Click Upload Document at the bottom of the screen to upload additional documents. Next, click Choose a File and select a file from your local computer or mobile device. Then, click Upload to submit the document. The county will receive the document in just a few minutes for processing. Click the BenefitsCal logo at the top left corner of the screen to go back to the dashboard. Now, let's look at how to submit an application on behalf of a client on BenefitsCal. On the dashboard, click to start a new application. An overview of the application process displays. Here, more information is provided about what to expect during the application. Select the county for the application from the drop list, then click Begin to get started. This is the application summary screen. It shows each section of the client's application and the status. You can navigate back to this screen at any time. Click Your Information to continue the application. Select a language preference, then click Next. Answer the questions that appear on the screen in the boxes provided. Click Next to continue. Check the box next to each program for this client's application. Click Not sure what to choose for more information. Click No to this question if the primary applicant, such as a parent, is not applying for benefits for themselves, but rather is applying for other household members, like their children. Let's imagine now that the client is applying for benefits for themselves as well as for their family members. In this case, click Yes to confirm that the primary applicant is also seeking benefits.
Hi, Martha.
Then click Next. Continue to.
Yes,
I'm sorry, I apologize.
that's okay.
I wanted to see if that's a video that we could actually send out to all the individuals.
This is a
A
video.
link.
Yeah,
Yes?
this is a video that we can actually send out to all the individuals. I
Great.
believe it's almost done. Again, I know that we're running out of time. Do we want to continue with this?
Well,
Or go ahead.
Actually, if you could send me that, I'll be able to send it out to everybody that's joined the meeting. And
Okay,
I know that I had sent some questions over to you ahead of time.
yes,
I'm not sure if you're willing to answer those questions now. I know we
absolutely.
promised our CECs that we would have time for that. And I just wanted to see if we could jump into that and provide the link.
Yeah,
in an
absolutely.
email.
Absolutely. I think, again, we only had like a couple more minutes for this video to finish, and it was going to go through all of the submission and also where there was some training tools available on the actual website. You know, just trying to make sure that I provided as much detail as possible.
Yeah,
Because there was several individuals that didn't even kind of know what
Mhm.
Benefits Cal looked like or what it did or what it was about. So yes, absolutely. I can go ahead and run through the questions now. Let me go ahead and stop sharing and I will pull up those questions.
Thank you. And I apologize. It's just
That's
so
okay.
we're on a time restraint.
Nope, totally understand.
Thank you.
Let me, again, new to Zoom, so let me try to do this without causing too much havoc here. Okay, so the questions that were submitted to me were, what's the timeline of an application when it's submitted through Benefits Cal portal? And so as mentioned in the video, once the application is submitted to our department, we do receive it immediately. And then once we receive it through CalSAWS, then we go ahead and obtain it, we register it, and we try to process it as quickly as administratively possible. For CalFresh, we do have 30 days. For Medi-Cal and CalWorks, we do have the 45-day timeframe processing. The next question is what is the meaning of each status category? And there was in parentheses, they stated submitted, pending, and processed. And again, as we were getting closer to that section, that video did go in through all the details of the submission status, but I will quickly go ahead and provide that. So for submitted, it means that the customer has submitted the application and the application is with our department. In progress, there is no pending, but there is a progress status, which means that the application has not been submitted to our department. It's still kind of pending on either the CBO side or the customer side, and it will not show up to our department, or our department will not receive it until it is actually in a submitted status. Processed means that the application has been processed by our department and it was submitted by the customer or the CBO. Can counselors find a determination or case outcome through the portal? And yes, through the CBO portal and the dashboard, there are, I think it was just getting into that section where it kind of showed you that you can open up the application within that dashboard and it would show you some information in regards to that specific application. So where can the following be found through the portal? The Medi-Cal, this is another question I received. Where can the following be found through the portal? The Medi-Cal number, the SIN number, assigned eligibility worker or processing team. And so all of that information in regards to the Medi-Cal number, the SIN number, or assigned eligibility worker or processing team does not display on the actual application. What does display though, when you do hit that dashboard and that application, it will give you the application number, the application name, the status, and if there are documents that need to be uploaded. If you click on the application's detail button, and again, that I think this would have worked so much better if I had gone through the presentation, the button will display more detailed application, such as the app date, the date of birth, if the case number has been assigned. If a case number has been assigned, that definitely means that we are in the process of reviewing the application. It's been registered, and it probably is going to go into the next stage of either not needing an interview, which Medi-Cal doesn't, or needing an interview for the other programs such as CalFresh or CalWorks. And then it's also going to let you know what documents have been uploaded or were uploaded with the application. It'll give you a history of that. And then the last question I did receive, are there currently any trainings being offered for the Benefits Cal portal? And yes, that video that I'm going to send is one of the training videos. It will walk you from registering all the way to submission, going through your CBO reports, and what information the CBOs can utilize from that portal. There are also, all these videos are also on benefitscal.com under the how-to videos under the Help Center. And there is also a benefits YouTube channel where there are several videos that are posted in regards to how-tos if you are wanting to assist the customer in renewing their benefits, uploading documents, scheduling appointments, reporting any household changes, or even requesting a replacement for EBT cards or big cards. So those are the questions that I did receive. I don't know if there's any more out there. And so let me stop there. And if there's no other questions, then I think I'm done.
I don't see any other questions in the chat. Oh, there we go. We have one. Let's see. Can a client do their own application? That's the question.
Absolutely. A client can register their own account for Benefits Cal and complete their own submission of applications.
Yes, thank you. Any other questions? I don't see anything else in the chat. But yeah, thank you, Martha. I know it is helpful to see the videos. Just unfortunately, we don't have enough time here during the meeting to kind of go through that one introductory video that you were sharing. But at least I gave those of us who have not been, too much into the system to kind of look around and see what it looks like. So we're not kind of afraid of going in there and filling out applications. I know that it is going to be a very helpful tool for our Medi-Cal, CalWorks, and CalFresh recipients. So thank you very much, Martha.
Rodrigo?
Yes.
Sorry, it's Nancy. I just have like a comment for those that are CECs, and if you have not yet used Benefits Cal, I honestly highly recommend it. I know change is hard, and trust me, when I learned about this change happening, Benefits Cal, I'm like, oh my goodness, no. But I have entered applications here. It is honestly, I remember Rodrigo came to me and he said, if you give me a 1 through 10, what would you score it? I said a 9.5. So again, we've been doing application assistance for many, many years now. I do highly recommend Benefits Cal. It's much better when it comes to faxing. I'm not sure how many CECs here on the call maybe have experience that maybe an application wasn't received or you were informed. That is not necessarily true. The application would be there. It just, right now DHS is swamped with applications. So when we enter it through the system, Benefits Cal, you know that it's gonna get there. And you can upload any documents, all the documents that we need, consent forms, everything. You could just upload it there. So honestly, for me, it's a peace of mind knowing that my job that I'm doing, it's going to be there, and I'm not going to be concerned or worried that, oh my goodness, did my application make it? Just give a feedback. An application I submitted at the beginning of the month, by the end of the month for Medi-Cal, it was granted. So again, I think it's a lot faster. I do know DHS has assigned, like, I believe a team or a group of people just to be focused on the benefits Cal. So for me, it has worked. So I do highly encourage all of you to look into it, and hopefully this will be the way that you will be submitting applications. As CHI for us, I think right now we're still getting prepared. As you know, Cecilia and myself are the ones submitting applications. So we're looking forward to next week. Any future applications will be submitted only by hopefully Benefits Cal, at least 99.9% of it. So again, look into it, highly encourage it. Thank you.
Thank you, Nancy.
Thank you, Nancy, for that. This is Martha again. And again, I know we're running out of time, but more than welcome. I mean, if you want to reach out to me directly, I can definitely provide more direction on a one-to-one basis, or provide any other information that anybody needs to be able to start utilizing Benefits Cal. So thank you.
Thank you, Martha. All right, we'll continue our meeting. We do have Medi-Cal and Covered California updates. First, we'll have Gayla from Department of Human Services provide an update on Medi-Cal program.
Good morning, everybody. This is Gayla. I'm the Assistant Program Director here for the Department of Human Services. There was some questions that was submitted for some follow-up updates. So I'm going to go ahead and follow up with some answers to the questions that you guys asked ahead of the meeting. So we can go ahead and get started. Alrighty, let me move this out of the way so I can. Alrighty, so one of the questions that were asked were, there are clients that have received a notice in the mail stating that they have yet to turn in their Medi-Cal renewal packet. However, they have not received a renewal packet in the mail. Will their Medi-Cal benefits be discontinued by the date on the notice that they are received? The answer is no. Our system automatically generates those notice of actions and they send them out to our clients. If they have any questions, they can always contact our CAT Center, and I've provided the number there. It's 1-877-410-8812. They can check on the renewal dates. They can go on and use their IVR PIN information. And if they're concerned about not receiving a packet, they can call in and request one. But if they do receive the packet, we really want them to complete it and send it in to us. We're encouraging those returned packets with the verifications. And currently our Medi-Cal renewal dates are continuing to be pushed forward 1 year, regardless if we have that packet or not. So you can ensure them that their Medi-Cal will not be discontinued based on not returning that Medi-Cal renewal packet at this time. Alrighty, next slide. Alrighty, is the hold still in place, or are individuals now getting discontinued from Medi-Cal for being over income or not completing the renewal? So based on guidance provided by the Department of Healthcare Services, which is DHCS, effective immediately, staff may begin processing changes in circumstances that include, but are not limited to, the following actions, as long as they remain in the same tier of coverage or better. Changes that result in a negative outcome must not have eligibility finalized in CalSAWS and must remain in their current level of coverage for the duration of the PHE and be tracked for processing at a later date. So we will update the system, but when we run it, if it's going to cause a share of costs, kick them out of the same tier of coverage that they currently have, we will delay that processing and we will track it until this PHE ends. Alrighty, next slide. So the case actions that we're talking about are our Craig versus Bonta referrals. Those are when we have a member who's receiving SSI income and they get their Medi-Cal with their SSI insurance through Social Security. And should that income end, we're going to receive a referral to go in and process Medi-Cal on their behalf through our office. Updating immigration status, sending a non-Magi screening packet, moving an individual from appropriate coverage age group. So when we have members that are timing out of one age group, moving them into another, any income changes, property changes, tax household changes, waiver cases, our inter-county transfers, LTC, when we're moving clients into LTC and back out of LTC, and when we're adding a new member to a household. Next slide. Okay. What is the most secure way to submit renewal packets and verification to DHS? So clients can continue to mail in their packets. They always receive a returned envelope when they receive those packets. They can fax it to our department. I provided the fax number there. It's 633-7498. They can continue to drop them off at our drop boxes located outside each packet or each office. And they can also upload documents through Benefits Cal. So when is the public health emergency PHE scheduled to end? Currently, the date that we have is March 31st of 2020. However, we're supposed to receive a 60-day notice notifying us that we're going to be transitioning back to processing Medi-Cal actions as before. Our county currently hasn't received that 60-day notice, so it appears that we will begin our transactions on June 1st, but this is always subject to change. This is just the most recent information that I have to provide today. And that's all I have. If there's any questions, you can ask me now, or I know we're short on time, and you can ask them and I can provide a feedback, and Angelica can share it out with the group.
Thank you, Gayla. Very, very informative. I love the slides, having it written there. You know, some of us are very visual. So thank you. Yeah, thank you. I don't see any questions in the chat. So we're gonna move on. We are running out of time here. So Khaled, thank you for being so patient and sticking with us till the end. So Khaled from Covered California will provide an update on the enrollment period we just ended back at the end of January. So thank you, Khaled.
Oh, thank you guys for having me again. Are you guys seeing my screen, or is this yours, Rodrigo?
Actually, I'm screen sharing.
Okay. Okay, thank you. All right. So in that case, again, thank you for having me. I'm glad to be back. For those who don't know me, my name is Khaled, and I work for Covered California's Account Services section, which basically handles the Navigator Grant Program. Work directly with YAUME and CCHI and its subs. So thank you. Next slide, please. So here's a quick look at the agenda that I'm going to be covering for today. We have a few slides under each one of those topics. Next slide, please. Thanks. So a big change to report out is that our board of directors has appointed Jessica Altman to be our new Chief Executive Officer, as Peter Lee has stepped down. For Jessica, it's going to be like a homecoming because she grew up here in the Bay Area. And so she's coming in from Pennsylvania. She'll bring with her a bunch of experience. She played key roles in the Obama administration while they were establishing and implementing the Affordable Care Act. She served as the chair of the Pennsylvania Insurance Exchange Authority, and a lot more vast experience, which I'm not going to really elaborate on, but we're happy and excited to have her here with us as our new CEO. Next slide, please. And now we've just entered into the special enrollment period where consumers can still enroll into coverage, but with a qualifying life event. For the past couple of years, consumers and enrollers, we really haven't seen the traditional SEP, and that's because of the pandemic and the qualifying life event that came with it that was pretty much open to everyone. Effective April 16th, however, consumers will need to meet a regular qualifying life event to be eligible for health insurance. As you know, learning about the ARP is no longer a qualifying life event. However, the public health emergency QLE, qualifying life event, is in effect until April 16th. And if the public health emergency is extended, the QLE, I'm assuming, is going to be extended with it as well. If not, we're going to return to a traditional SEP at that point. So we want to get people in. The door is still wide open to get them in before that public health emergency comes to an end. By the way, is my voice coming in okay? Just want to make sure before okay, great, thanks. So Covered California has a new qualifying life event for those eligible to APTC, and that is folks who are at 150% or less of the federal poverty level. This group is going to receive a $0 premium benchmark plan, which is the second lowest cost silver plan available to them in their region. So that's some fantastic news. And by default, the enrollers, you guys are going to see the plans that offer the greatest benefits to the consumer. But there's going to be an option, or there is an option to turn off that filter so that you can see all available plans in case they wanted to see that. Next slide, please. Here are a couple of more new qualifying life events. So for someone who has paid part or their entire penalty for not having insurance last year, has a qualifying life event to get into Covered California this year. So let's say someone does their taxes in May, for example, and they pay a penalty, whether they know it or not, they're paying a penalty because they didn't have enough insurance last year. They now qualify for, they now have a qualifying life event to enroll into Covered California this year, so they don't go without insurance again for next year. As I already mentioned, the public health emergency due to the pandemic, which is set to end April 16th, is another. Obviously we don't want anyone to wait till April to apply or until they do their taxes. We want to get them in as soon as possible, because it probably means that they went without insurance in the beginning of the year. So that may result in another penalty next year. And lastly, the loss of a job or loss of income. This might panic some enrollers, because you're not going to see that as a drop down on the qualifying life events anymore. But that doesn't mean that someone who loses their job or their income can't apply for insurance. All it means is that the enroller has to select the other option, and then that would suffice for loss of job or loss of income. Next slide, please. So full scope Medi-Cal is going to be expanded to income eligible individuals age 50 and over, regardless of immigration status. And this is supposed to happen sometime in May of this year. The ARP and its subsidies are still with us throughout the rest of this calendar year, and may be extended through to 2025 with the proposed Build Back Better plan, if that goes through. And lastly, for this slide, there are still many consumers who are opting to take the tax penalty, thinking that it's cheaper than purchasing health insurance. We're hoping that CECs, have a detailed conversation with them, and if they're, over the phone or in person, whatever, that they walk the consumers or the potential consumers through their options on how much they're really going to pay versus how much their penalty is going to be. Just to make sure that they're making an informed decision. Next slide, please. So because of SB 260, consumers exiting Medi-Cal who are eligible to Covered California are going to automatically be enrolled in a plan with Covered California. We give out reports to our lead NAVs, which have a list of consumers on these reports who are exiting Medi-Cal and coming over to Covered California. And those reports should be provided to you as we provided to the lead NAV, CCHI in this case. The enrollers should reach out and make sure that the consumers, if there are any consumers on their list, are aware of this transition happening, and that they're, more importantly, effectuating their plans. So as we know, just because you're enrolled in a plan does not mean that the plan is now effective or good to use until you make that first payment, that binder payment. So we want to reach out to these folks. Hey, you've been transitioned from Medi-Cal to Covered California. Did you know that? Yay, fantastic. Here's how much your binder payment is, or let them know that they're going to get a bill if they haven't already, and so that they just pay their plans. And this is also a good time to see whether or not the consumer wants to change their plan or keep the one that they were automatically enrolled in. Another great benefit of this is that it helps to avoid gaps in coverage. And then consumers who qualify for a zero cost enrollment may need your help on updating their case details or updating authorization forms, a whole bunch of reasons why we should reach out to the consumers on this list that's going to be provided to you guys. Next slide, please. So here's a deeper dive into the governor's budget with some key features that we're going to be watching. The state CSR reduction program, which is designed to reduce the out-of-pocket cost for consumers, is supposed to be implemented by next year, 2023. Governor Newsom is also proposing to create a new department. It's going to be called the Office of Healthcare Affordability. One of the aims of this office will be to increase pricing and quality transparency. The goal is to have healthcare cost savings return to consumers who are directly impacted by these increasing healthcare costs. This new office would put in place a really good strategy to contain healthcare costs, set targets for what's affordable, and then push accountability, as well as being a really innovative department. Also to note, California state subsidies will cover the $1 non-hide abortion fee, so that $0 net premiums are possible for everyone eligible. And lastly, Governor Newsom is the first governor in the nation to expand full scope Medi-Cal to undocumented immigrants age 50 and over. As mentioned earlier, this expansion is in addition to a 2019 expansion of Medi-Cal to undocumented children and young adults through the age of 26. So we're getting there. Next slide, please. The Build Back Better plan, again, is in negotiation, so nothing is definitive, but we're hoping and anticipating that the parts of the bill that's related to health coverage will have enough support that it'll be included in any version of a proposed package. Some other parts of the Build Back Better plan have been scaled back to try to get approval with the Senate, so there's less disagreement there. Next slide, please. Now we move on to a couple of CalHER's updates. Release 22.2, I never knew what these numbers meant, and in case anyone doesn't either, it just stands for the year and the month in which the changes were implemented. So release 22.2 really stands for February of 2022. It included some updated information and job aids for enrollers. And something else to kind of remind you guys about again is there's no longer a 15-day rule. So CalHER's, with this release, CalHER's should allow for the first of the month coverage, regardless of when an application is completed. So if someone is completing an application on the 25th, they should still see and be eligible to first of the following month. If you think that there's an error or you see a start date that needs to be corrected, please contact the service center, keeping in mind that the service center has their own escalation process in case the initial representative is not able to assist. And then the final slide that, yeah, this brings me to a close here. This is my email address. Again, I thank you guys for having me. I can take any questions now or, in the chat or something, and then get back to you guys on a follow-up email. Thank you.
Thank you, Khaled. We don't have any questions here in the chat, but as always, we will take questions through email or whatever, and we'll have those for a future update at one of our meetings. So thank you, Khaled. Thank you to all our presenters. I know we kind of ran out over time this month, and thank you all for your patience. And I hope it was worthwhile to stick around and get all this information. So thank you, everyone. And last but not least, we'd like you to fill out our evaluation for our meeting today. This information helps us to plan our future meetings. And so if you could please fill that out for us, please. And unfortunately, we don't have any time left for announcements. But if you would like for us to share any upcoming events for your organization, please feel free to submit those to Argelia. If you have any material that we can distribute, we'd be glad to do that. So thank you all. And with that, we'll say goodbye. Thank you for filling out our survey. Thank you for your participation. And we'll see you. Let's see, I don't think we have one scheduled yet, but in about 3 months, we'll reconvene and meet again for our CEC network meeting.
Rodrigo, I have a quick question.
Yes, Colin.
Are you able to send out that survey again?
Which survey are you talking about?
The one that was just on the screen.
Argelia, are we able to do that? I think we could print it out and send it out. Oh, this one?
Launched it.
Oh, there we go.
Yeah, because I think I'm probably, I can't take the survey, and so I ended it.
Oh, it's because I think I still have you as co-host. That's why.
Yeah, I thought I ended it for myself, and I realized I ended it for everyone. So I just want to make sure you guys get one to participate.
Oh, okay.
I won't touch it this time.
Thank you. I forgot to remove your capabilities. Thank you.
Yeah, thank you, Khaled. All right, well, it's on the screen. If anybody did not have a chance to fill it out, go ahead and fill that out for us, please. And thank you all for your patience. This is a great meeting, lots of information, and sorry we ran a little bit over time.